Okay, then I will call the meeting for the Neighbors of Dunn County Standing Committee to order. It's August 22nd, and we have a quorum with Supervisor Laufer and Supervisor Lyon and myself. So the next up, approval of the minutes. You had the minutes sent to you by Chris. And are there any corrections or changes? No? Okay, then I'll take a motion to approve them, please. Okay, Supervisor Laufer, Supervisor Lyon, in that order. All in favor? Aye. They are approved. Is there any public comment? There is no public comment. And then continuing on with what we've been doing is educating us about the neighbors of Dunn County and all the different moving parts. And this will be an ongoing activity for us. So Carmen, would you introduce Alyssa, please?
Thank you. We have Alyssa Dowdy with us today, who is our life enhancement department head for the neighbors, and she's going to go over how activities interacts with the overall operations of the neighbors and what she does every day with our residents. So she's the fun department.
Hey everyone. So like Carmen said, my name is Alyssa. I'm the life enhancement mentor at the Neighbors. So our department overall is a little bit of a smaller department comparatively to nursing and things like that. But we have one activity staff per building and then a life enhancement assistant as well. So we've got Chuck over in our west building. And then Quentin in our east building, and then myself and Sam are kind of in our central building. Primarily work in those buildings because we're kind of all over the place. You'll see us in all the buildings if you're in any of them. So Chuck has actually been here and going to be in September for 40 years. And then Quentin, I think, is like 12 or 13 maybe. So, and then Sam, I think, just is hitting 4 years this month. So got a lot of longevity in activities, which is super awesome. Especially after I started, they taught me a lot of stuff. I'm like, you guys just let me know how it works. But just to talk about our activities calendars a little bit, we've got activities calendars for each building. We really try and cater it to what the residents enjoy. So if you look at each one of our activities calendars, they're a little bit different in each building just because all the residents in each building are so different too. So we'll have some stuff that's consistent throughout the buildings, but really try and get to know the residents and get to know what they like and do the things that they like because that's what we're here for. So we do a few different kinds of activities, I would say. So socially, we try and get people out and doing things as much as possible together, just because it's really easy for people to get lonely, isolated, depressed in that kind of long-term care setting. So we try and get people out of their room. Sometimes it's a little more challenging, but I like to think that we put on fun things that get people together and doing fun stuff together. Physical activities, so try to get people moving. Depends on the household whether people want to do that or not. So one of our households, Chuck, does activities or physical activity, chair exercises every morning. We also try and throw in like some sneaky exercise, I call it. So you don't actually call it exercise, but you get yeah. So like beanbag toss or balloon volleyball or things like that. So people are moving, but you don't technically call it exercise. Sometimes people shy away from that. We do some different creative activities. So we'll do like paint and sip classes where we take like people through step-by-step paintings or different projects. Sharon Tripp actually is super awesome and comes in and does a lot of art stuff with our West building. She's always got like the most creative ideas. So that's super awesome. What other things? We try and like cater to the time of year. So like we'll be doing like apple and pumpkin stuff now that it's getting to be the fall time and things like that. Kind of under the creative, we'll do a lot of music stuff as well. So Quentin is a music therapist. So he'll do a lot of musical stuff in his building. as is Chuck and stuff, but like music therapy sessions, sing-alongs, name that tune, things like that. Try and get people remembering the songs they used to listen to when they were younger. And then we also have live music come in every other Friday. So we have entertainers from the community come in. We'll serve drinks and snacks and do things like that. So hopefully they have a good time with that. We also do have spiritual activities. So we have a chapel in each one of our buildings. We'll have a non-denominational service every Wednesday and a Catholic Mass every Thursday. And then once a month, we have a Lutheran communion and a Methodist service as well. So that's a cool opportunity to bring in, good morning, bring in different denominations. If we have residents that attend those churches, we're always willing to add in new services if people want them and stuff like that too. And then the last one, I think this is the most fun, but community integration type things. So getting the residents out into the community. A lot of our folks were like longstanding members of the community, so it's super fun to get them back into the community in ways that they might not be able to if we don't have like a bus or some sort of transportation to get them back out. So like yesterday we took them to Scatterbrain in Downsville and got coffee and pastries and ice cream and stuff like that and enjoyed the outside seating that they had. Going to the band concerts on Tuesdays. We've taken a tour of the Maple Tainer, different things like that. So just kind of keeping those connections with the community as much as we can. That's another really great opportunity for residents to suggest places to go to. We've taken a lot of suggestions. People are like, oh, I really wish that I could go back here and do this. And if we can make it happen, sometimes it's not super plausible, but we try to. And then the community coming to us as well. So we've had a lot of groups come in to do activities with the residents. So the middle schoolers have walked over. We're actually next Friday having the Dunn County Play Group come over and do some sessions with the residents as well. We had the Stouts exchange students from Korea come and play some bingo with the residents, which is a really fun thing to do. And then just volunteering in general, people coming in and doing one-to-one visits, helping out with different activities, helping out with like decorating around the holidays, things like that. So it's been really fun to welcome back volunteers after not having them for an extended period of time and stuff too. And then kind of talked a little bit about the bus, but we've done a lot of fundraising and stuff like that, mainly for the bus. And then now we've kind of moved that to landscaping and doing a few improvements outside and things too. So yeah, that kind of is a little quick synopsis of activities at the neighbors. Does anybody have any questions at all?
Yeah, turn on your mics though, so that the people listen at home can hear us.
Yeah, I had a question. The groups that come in to play music and stuff, are they just totally volunteer to do that just for the benefit of the residents then?
Some folks do,
Yeah.
and then some folks we do pay as well.
Okay.
So we pay some of the it just kind of depends.
Oh, okay.
But yeah, we have a couple volunteers, and then like around the holidays, the Memories will come in and do a volunteer Christmas concert for us and stuff too. I just reached out to them the other day.
Yeah.
So just kind of depends.
Okay.
Yeah.
Okay.
Hello.
Hey, Gordy, welcome. We see that you're online. I hope you
Yeah,
caught some of it.
I did. I got most of it. I'm not having a good morning, but I did want to ask if they had any plans on if any of the residents wanted to come to Downsville Day, which is Saturday.
Yeah, so weekend things normally for activities, our wonderful CNAs and homemakers do activities like weekend stuff. So we have not ventured out to do trips on the weekends and things, but we were in Downsville yesterday for at Scatterbrain, and people were very excited to get down there. And we actually had a couple folks that were like, I've never been to Downsville before. So yeah.
All righty. Thank you.
Go ahead, Tim, or
Yeah, now I lost my train of thought here. How many, like, do you have to have so many like CNAs or so many people along per resident, or how do you determine how many people to, safeguard the welfare of the residents as you're taking them out?
So we usually have two activity staff going out on the bus and things like that. So two people to load and unload, and then we kind of assess which residents are appropriate for which outing. So depending on what we're doing, we take different folks along with us. So some folks might be more appropriate to just go on a ride where we don't get off the bus because they might wander or things like that. So we
Right.
kind of make that determination
Right,
depending on which outing it is.
sure.
And then we don't generally have CNAs with us. It's just activities staff.
Oh,
for
okay,
that. So
okay. And how many activity staff people are there?
myself and then Chuck, Quentin, and Sam. So four of us
Four.
total.
Okay,
Mhm.
okay. Thank you.
Supervisor Lyon, you had a comment?
A question, what do, how do people volunteer? And I mean, is there information out there listing the kinds of things and?
So we have a volunteer application on our website
Mhm.
that people can fill out. And then I usually I have a list of folks that have volunteered in the past of like emails and things. If they volunteered for like outings and things to help.
Mhm.
I guess that's another thing. If we go to an outing, like when we went to the fair, and we need more help or like a one-to-one situation, we have volunteers come and help push residents around. So
Okay.
the fair or shopping or things like that,
Mhm.
we get a little extra help from the community for that. So I'll email the folks that have been volunteers in the past, as well as family members.
Mhm.
So a lot of family members really enjoy doing that kind of stuff with their loved ones because they might not necessarily be able to get them into their own cars. So they
Mhm.
just meet us
Yeah.
at the location and they're able to spend that time with their family members.
Okay.
And then I also usually post on Facebook volunteer opportunities.
Okay.
And then people will contact me from that as well.
Oh, that's wonderful.
Yeah.
Yeah. And so volunteers are vetted in some way through the,
Yes.
yeah,
Yep.
okay. Cool.
Yeah, great. I've been over there and I've seen Alyssa working and I've been to the concerts in the evening and I see them loading up the bus and so forth. But then after listening to her telling us all this, I had no idea how many different things you have going on. So it's really amazing.
Yeah.
Anything else before you move on to your next meeting?
Yeah.
Gordy, anything else?
No, I appreciate your time.
Thank you.
Okay, then thank you very much, Alyssa. It's
Thank
good to
you.
see you again.
Have a great day.
I think it's pretty easy to see she's in the right job. Okay, thank you for setting that up.
Of course.
And number 6 on the agenda, Community Mentor Administrator Report, Quality Assurance Steering Committee updates.
All right. So as always, we start with the Quality Assurance Steering Committee, which is our monthly meeting for QAPI, Quality Assurance and Performance Improvement. So this month we had our pharmacist there, which he comes every quarter. So every 3 months he shows up and he goes over our pharmacy report. So there are specific standards basically or percentages of different kinds of medications that it basically compares our facility to state averages, federal or national averages, things like that, to make sure we're not overprescribing narcotics or psychotropic medications, things like that. So we go over that report, make sure we're on the right path. Historically, we haven't had any issues with that. We do sometimes take more challenging residents than some facilities might take. So we do tend to be on the high end of averages, but nothing concerning. So we do have quite a few people that have higher psychiatric needs than some for-profit facilities and things like that. So that sometimes leads to having more antipsychotic medications, but nothing that doesn't have a good rationale, and making sure we're following all of the review processes for those as well, because those all are part of our CMS regulations. Also at our QAPI meeting, we went over a matrix outage, and forgive me because I do not know if this was discussed at a previous meeting when I was out, but we did have an outage of matrix, which is our EMR system,
EMR.
electronic medical records. Sorry. Um, So basically, it's where we chart everything. It's where the resident's record is, their medication list, their diagnoses, any assessments that we do. And Matrix is the company we use for that. And we had an outage of that like a month or so ago. So we just reviewed our new policy for that. We had actually recently, probably it was about April timeframe, had a situation where Matrix wasn't working and had come up with a policy for that. And then the second time that Matrix didn't work, there was new factors that our policy also need to be updated again. So still working through that, but have a good plan and some extra safeguards to make sure that we have proper information in the case that our technology does not work. And doing some education with nursing staff as well, as a lot of our nursing staff has never charted on paper charts as they are young and had never not had computer charting. And then the rest of our staff that has, it's been a long time. So making sure that everyone knows how to do that. So we were going over that. As well as, I believe you all met Charles, our new director of nursing. He has been working on a falls program to prevent falls and making sure that we are lowering the number of falls that we have. Falls are inevitable, they do happen. But one of our biggest things is we may not be able to prevent a fall, but we are able to prevent injuries from falls. And that's the biggest thing is if somebody falls, making sure that they're not getting hurt. So falling safely sounds kind of silly, but it definitely is something that we focus on. We would love to be able to just prevent falls altogether, but unfortunately that isn't always going to happen. But trying to prevent falls with any sort of injury is a big push. So we talked about that as well. Any questions on quality assurance?
Supervisor Lyon.
With the, the psychotropic drugs and things like that, are my husband recently died and he was on palliative care. And, he was on medication like fentanyl and oxycodone and things like that. Does the neighbors have like, its own palliative care option, or does that come from the outside? Like, we worked with Mayo.
Sure. So we do not have our own company that does that. We have separate hospice companies that come in, and some of them offer palliative care versus true hospice care. We do what's called comfort cares at the neighbors too. So it's not technically meeting palliative care definition, but if someone isn't ready for hospice yet, but really is just focusing on comfort versus healing, we have basically protocols for comfort care. So it does change medications. We're not giving 15 vitamins a day anymore if someone's on comfort care or basically just focusing on keeping them comfortable. So we do have that. It's not necessarily labeled palliative, but it's similar.
Okay. Thanks.
And go ahead, Tim.
Did I hear you correctly that you're now having nurses actually do paper?
Oh, no, only if we have an outage. So
Okay.
we don't do that regularly, but we are making sure that they're all comfortable doing it because it has happened twice in the last year that we have had some technical difficulties, both for very different reasons. But making sure that in the case that we have to do that, that people know how, but not regularly, no.
Okay.
Everything is typically done in the computer.
Thank you.
Supervisor Story.
Yes. Thinking on his question, if there was a power outage, how would you access what medication they should take?
Sure. So there's a couple of different things. If we have a power outage, well, first of all, our power outage would be very unlikely because we have very large generators. So power is one of the things that we have a lot of backup plans for. In the case that we had a complete like internet access outage, we have now a stored file that's separate from our EMR system. So it's on the shared drive, like the county's shared drive. So, and it's updated weekly. So there may have been slight changes to it during that, but it's our closest we can get. And we also have that now saved on a thumb drive as well, in case there were to be some sort of cyber attack or something on the county's drives. So, and that's also updated weekly. So we would use one of those resources to print copies of what is absolutely necessary. In the worst case scenario, if we had no access to anything, we couldn't get on anything, the medications for anything that is not over the counter are actually in what we call them bubble packs. So they're on sheets about the size of a sheet of paper, and they have the day and time on them and what they are. So we would actually be able to administer everything that's not an over-the-counter drug, because the packets for each resident would tell us when they need to be given and things. So, and that would be the ones that we're most concerned about versus an over-the-counter medication. That would be worst case scenario if we couldn't get any of the other things.
So as new medication prescriptions come in, then you're actually posting it to two places. Then you're posting it to that file as well as to the computer.
Yep.
Okay,
Mhm.
okay, thanks.
A lot of interesting questions and answers.
Mhm.
Any more? Then I've been remiss. I did welcome Carmen back before the meeting started, but we should do it officially. It's good to have you back, Carmen.
Thank you.
Welcome. It's good to see you here at the table, and we look forward to you being here for a while.
Thank
Okay,
you.
yeah, good. So let's move on then to employment activity report. Is Chris on?
Yes, he is.
I am. Can you hear me?
Yeah.
Yes.
Good morning. So about 3 pages in on your packet, you'll find the employment report for July. Types of recruitment remain the same. Number of interviews that we did in July were 9. Of those interviews, 9 positions were offered and 9 were accepted, 2 above a step 3. So there was 1 nurse and 1 CNA that had requested higher than what I could offer. If we go down to resignation reasons, first one, not a good fit, just kind of left. The second or the next kind of set of 1, 2, 3, 4, kind of college, high school graduations, sports schedules, things like that. Not bad reasons, just kind of, they moved on. The last 2 were full-time RNs. 1 accepted a billing position in finance for the county, and 1 nurse just kind of walked off the job. So the one that went to finance, I was sorry to see her leave the neighbor. She was a very good nurse, but I was happy that the county was able to retain her. So if we go down to open positions, those were adjusted with the onboarding, offboarding. We go down to work comp lost hours. It's not much has changed there. The biggest thing that did change, we had an uptick in positive COVID staff in July. So we missed roughly 34 shifts were missed in the month of July. That's about all I have for the employment report.
Any questions or comments? Well, thank you very much, Chris.
You're welcome.
We're on to 6C then, Carmen, the CNA training program.
All right. So Chris might actually have better numbers for this than I do off the top of my head. But we are still doing the CNA training program. We did have classes, I believe last week was the last class was still going on. I don't have a actual number of people who've gone through it yet. I don't know if Chris does, but it's going well. They've been there every day that they're supposed to be, and we've had lots of students, so it's still going well. And I believe we have had some people start working at the neighbors that were students from them too. So that was the overall goal. So we are happy with how that is going thus far.
The classes have been pretty full. This next class starting, I think it starts after the Memorial Day weekend. we actually have 2 neighbors of Dunn County employees in that class. So, and that is another full class. So,
There any questions about the CNA training program? Okay,
No, good, thank you. Let's see, environmental, resident referral report.
so that is also in your packet. So we started the month of July with 108 residents. We had 92 referrals during the month. We had 5 residents admitted to the neighbors, and we had 87 not admitted to the neighbors. We ended with 103 residents. We had 1 resident transfer to another facility. We had 3 deaths and 4 discharges. And our referral sources now, especially since the closure of Sacred Heart, are pretty much always the Mayo system. Every once in a while, we'll have a Marshfield person, but for the most part, it's all coming from one of the Mayo hospitals in our area. We did have, as Chris mentioned, an uptick in COVID over the last month or so. So that does limit when we can accept residents into the neighbors. Fortunately, we are on the downside of that at the current moment. So we are accepting residents, and we have had quite a few admissions over the past couple of weeks. So we are actually back up to the close to the 110 at this point. So that's good news. We have had several admissions, and Fireside was filling up, and we do currently have a staff member that worked in Fireside that was positive. So admissions to that household has stopped again. But before that happened, we were able to admit quite a few people down there. So hopefully by the time that all those discharge, we'll be able to accept again. So it is going okay with admissions, and the outer buildings are still remain nearly full as well. Any questions on admissions or referrals?
Supervisor Laufer.
Yeah, before, when people apply to be admitted, are they required, every one of them, to be COVID tested prior to admission then? How do you work that all with the?
Yes, so we do kind of 2 things. So most of the time residents are coming from the hospital. So the hospital will just test them before they send them to us.
I see.
So, and then we also do a test when they arrive to us, because sometimes we have had hospital one come back negative, they come to us. Just things can happen in a short period of time. But the big thing with that is just trying to make sure we don't put one of our households into an outbreak, because we did for a while stop doing testing prior to coming in. And then it happened about a week after we stopped. We had a resident that they came into the neighbors and the next day tested positive for COVID. Then that household's in an outbreak. So trying to prevent that and keep people that have COVID not with our general population, things like that, to prevent it spreading, as well as to making sure that we don't have to have them in an outbreak. An outbreak at this point, all that really does for change of operations is we do test all the residents, staff and visitors wear masks in that household, whatever household is in an outbreak, and then we don't admit to that household during the outbreak timeframe. But besides that, residents are able to leave their rooms and do all the things. So it doesn't affect the residents as much necessarily during an outbreak, but it can affect operations.
Now, you have a household that's closed, or you can't admit because of COVID. And the minute that you've gone through that time period, do you go back then and admit people from a waiting list, or how do you choose people to start filling up those beds?
Sure. It depends on the household. So if it, say, for example, Fireside, we're currently in an outbreak for Fireside. Once Fireside ends their outbreak, so after 14 days without a new positive case, we would just start accepting referrals from the hospital system, because anybody who we denied during that time frame, unless it was the day before or 2 days before, is probably placed somewhere else. So we would just let the hospital system know we're accepting referrals again for that household, because that is our short-term household. So that wouldn't necessarily be on the waiting list. If it is a rehab household. If we have open beds at that time and not active referrals, we would start going down the waiting list. Many a times our waiting list people are not ready to come to us yet. So we start calling off the top of the list and then go down based on an appropriate room. So depends on if it's memory care, traditional long-term care, because some people are on one or the other. Some people are on both. It kind of just depends on the situation.
Go ahead, Supervisor Laufer.
You mentioned Fireside. Is that east, central, or west, or what is
That's
that?
central. So
That's
that's
central.
that's our rehab household that is in central.
Okay.
So that's the household that is typically short-term rehab patients. So they come in with the plan to go home. So they come in, they get therapy, wound care, whatever they need to be successful discharging home.
Okay. Thank you.
Yep. Any other referral or admission questions?
That looks good. Let's go on then to 6E, Environmental Facilities Report.
Okay. I don't see Scott on the call. He is also in that meeting, I believe, with Alyssa. So I bet he is not available for this currently.
Are there any big problems that you know?
No.
Okay, that's good. We can go on to the next one then.
Okay.
Medicaid rates, that sounds really fun.
We talk about these a lot. Unfortunately, in the last couple of years, Medicaid rates have not been grown as we talk about them. They have improved quite significantly, especially compared to 4, 5, 6 years ago when we were the 50th of 50 states for Medicaid rates. So we don't have that situation going on anymore. We did in the last couple of weeks get our interim rates. So Medicaid sends out rates that are not technically finalized yet. It's basically they're still working on them, but they give us rates in the meantime, but they can change. It's kind of silly. So we don't have our final rates yet, but we do have interim rates. The one thing of note for this is that supplemental payment, which is a payment system that is only for county or municipality owned nursing homes. We've talked about this a little bit in the past. I'm not sure if with our new committee or not. But it's an extra payment basically for county owned nursing homes outside of the Medicaid rate, but through the state system. It is to help offset the losses from Medicaid. They changed how they are doing that this year as of the beginning of the fiscal year, which is July. This year, instead of doing one lump sum payment that was divided into 2 payments, they are doing it as an addition to your Medicaid rate. So it's paid out as part of your rate. So for every Medicaid day that we have, each resident's rate is increased by a certain amount instead of 2 large payments throughout the year. In the past couple of years, Dunn County has been one of about half of the counties that hasn't gotten a supplemental payment. It has been divided up based on losses, and there's been other county homes that have shown significantly more losses. So it's just a certain dollar amount that gets dispersed out. So we have not received one in the past couple of years. This year, for the part that's being added on, we are currently receiving an increase of a rate. We are working, and when I say we, I mean mainly Jane, has been working with our Medicaid auditors and the Medicaid auditing team because in the past, the neighbors has only received one payment, but it has encompassed the losses across all 3, which has been fine, less calculating necessarily of getting 3 separate payments. But it has been only associated with the central neighborhood, but then we just disperse it out. I mean, it all goes into the same bank accounts eventually anyways. But with the new system of how they're attaching it to rates, that means only our central neighborhood is getting that add-on right now. So Jane has been working with the team at Medicaid to see if that could be divided out, considering that central is our least full household and has the least amount of Medicaid, because that rate increase only goes to the Medicaid residents. So if they're on Medicare, private pay, other insurances, VA, that we don't get that increase for them. It's only for Medicaid residents. So we're working on that to see if we can get that dispersed between the three instead of just one. When we asked about, I believe when I first started, so 6 years ago, I asked the Medicaid auditors, I was like, why is it just one? And they're like, well, does it matter? And at the time, it really didn't, but now it kind of does. So we're working on that, and hopefully we'll have an answer that it's being spread between the three, because currently we don't have much Medicaid in Central. So, any questions on Medicaid rates?
Supervisor,
Are they all, um, aren't they all considered to be one, it's one unit though, right?
No. So we are three separately licensed nursing homes. So each of the three buildings is separately licensed with the state and with CMS, the federal regulators. So because they are not connected in any way, they are three separate entities. They all are under the umbrella of Dunn County as an ownership, but they all have different Medicare numbers, Medicaid numbers, and state licensures.
Why did they set it up like that, or is there a
Um,
reason for that? or-
There is. So in that time frame was the beginning of the push to have smaller nursing homes, to make them less institutional. So Medicaid started doing an incentive for being less than 50 beds. So when we moved from this building, which had originally started at over 200 beds, moved over to the smaller three buildings, it was an incentive per Medicaid day to have be less than 50. And we still do get that incentive. So it is a financial idea to have them be separate. It'd be very interesting, but very time consuming to figure out if the financial incentive we get for being small outweighs some of the other costs we have for doing everything times three. I'm not really sure. But at this point, we can't connect. We'd have to physically connect them, which would be a whole another undertaking. So they're three separate. Mhm.
Thank you.
Yep.
Supervisor Story.
Just to elaborate on that, a number of years ago when they were still here and it was determined that we needed to do something because we were losing money and it was in bad shape, it was kind of controversial at the time with what we were going to do, but ultimately what was decided is that we went around and we saw some different concepts in different areas in Iowa and different places to see what we might want to do for ourselves. And the big thing that was important was to have these individual houses, so they weren't all mixed together. That would also include their own kitchens, and it would be more home-like, a living room environment, that kind of thing. And so it was determined to do it that way. So in addition to the financial piece that she was explaining, it was determined that this would be something that would be more in line with today and make it more possible maybe for people that might want to utilize our facilities. And I guess it has paid off and that it has shown that that has been a good thing. So, so we can close one of the buildings if we don't have enough people to go in that building, and that can save us money. But then again, it also helps us with regards to the financial piece. So that was just something the board decided several years ago.
Thank you.
Any other questions on that?
I think not.
Okay.
Then a self-report survey. Hmm.
So, and I apologize because I can't remember exactly what has and hasn't been discussed with the new group. So, I'm sorry if this is overkill and repeating myself. But so surveys are something that we have annually. They are conducted by the state of Wisconsin and then sometimes the federal government, if we're one of the lucky 2% of the facilities in the country that get a federal survey. Those are annual surveys. Each of the three neighborhoods gets their own annual survey. We're pretty much always in a survey window because they can come anywhere from 9 to 13 months since the last time they were here. And those surveys, they look at everything. They come in and it is our recertification. So they watch MedPass, they watch meal service, they talk to staff, talk to residents. It's all encompassing. In addition to those annual surveys, we can also have what's called a complaint survey, or a self-report survey. So these are surveys that come out of our normal window. Sometimes they can happen during that window if they're just not ready to come for the annual yet. But lots of times it's kind of sporadic in the middle of the year, away from when that building has their own survey window. Because if it is during their window, they'll lump them on with the annual as well. But these are surveys that are about a specific event or a complaint from a family, a resident, or an anonymous complaint from anybody. And they come in and they're only there for that specific reason. So if they're there because there's a complaint about a medication error, they're not going to go in the kitchen. They're just going to look at MedPass, the EMAR, talk to residents, things like that. So those can come if a family member or resident files a complaint with the state, or if we do what's called a self-report. So anytime that we have something happen that is what's considered reportable to the state, if there's an abuse situation, a neglect situation, missing money, resident to resident altercations, any sort of event that might happen, we report those to the state, and we have a time frame that we have to do that and do an investigation and then report final findings, basically. Those can also trigger complaint or self-report surveys. They basically come in, make sure we did everything we were supposed to do, basically followed all the steps of an investigation, and then decide if there's any errors from there. It's kind of hit or miss. They don't come in on every self-report. It kind of depends on the severity of the situation, or if in the report we submit if they think we missed something. And then sometimes they just come. So this was actually the week before I returned. There was a self-report survey that they showed up to the central building. Turns out they were actually, one of them was for East and one was for West. So after about an hour of getting information for Central, they realized they were in the wrong building. So it might have been just submitted incorrectly to that building. Not really sure what happened. But so there's two surveyors. One went to the East building, one went to the West building. They reviewed the self-reports and everything checked out fine. They had no concerns, and they left fairly quickly within a couple of hours. So that's best case scenario when those things happen. They just have to do their due diligence to make sure we're doing our due diligence. So that all went smoothly. And then we are actually in our survey window for the East building. They were here last September. So right now we've been seeing surveys happening around the 12 to 13 month time frame. So expecting them sometime in early fall. Any questions?
When you refer to them as they, what department is this under, these surveyors?
Sure.
What,
It's DQA, which is a department of DHS. So the department, DHS is Department of Health and Human Services, and then DQA is the Department of Quality Assurance. So they are part of the overall State Department, and then DHS oversees all of the different DHS departments, and then DQA is specifically our regulatory body. Those surveyors are state surveyors. They're the ones we see every single year, and then all of these little smaller surveys are kind of sometimes every year, sometimes not. And then we can also receive surveys from the federal government, which is CMS, which is the Centers for Medicaid and Medicare Services. They come out of Chicago if we have them. Those can either come with our state surveyors or they can come after our state surveyors. And their role is more to actually survey the surveyors. They're making sure that the state surveyors are doing what they should be doing, because DQA state follows CMS's rules. So they're kind of subcontracted out state by state to make sure that they are enforcing CMS's rules. It's confusing.
yeah. And is there an appeal process if you?
There is. So if we receive citations from them, citations can come in a lot of different forms. So there's something called the scope and severity chart. So basically, how bad of a situation was it and how many people did it affect? And then basically every tag we get, they're called F tags. It's basically every regulatory issue they find comes with a scope and severity. So if we have a tag that is a larger scope and severity, they are all lettered. So most are come in at a D, which is a low level, low amount of effect. We don't really ever appeal those because it doesn't come with the civil money penalty. It doesn't come with any sort of infractions or anything. We submit a plan of correction and it's done. If we receive a tag that's a higher scope and severity, probably starting at a level G all the way up to what's considered an IJ or immediate jeopardy, we appeal those. So there's a process that is called an informal dispute resolution where we submit basically why we don't think we deserved that citation. And then we have a call with a third party company, basically with us as well as with the people from DQA on the call. And then we get a decision from them. Unfortunately, those are not very often won by facilities. It's, I believe, right now about an 85% fail rate on winning those situations, but it's worth a shot. We've done it a couple times. And then after that, there is a secondary appeal process as well that gets then into filing actual like attorney related appeals and things like that.
I was going to ask if that ever leads to litigation with,
It can.
okay.
Mhm.
Thank you.
Luckily, that doesn't happen often. Normally, our citations are little minor things like someone wasn't wearing a hairnet and serving food, and we tell them to put a hairnet on, and we're done with that. So most citations are minor like that, but it does happen from time to time that there's a bigger thing that we need to address differently. Any other survey questions? I assume in the next couple of months, we'll have a report on a full survey, which will be more encompassing of how that all works, and we can go over that at that point.
Sounds good. Let's go on to number 7 then, consideration for action to be taken by the committee, review of vouchers and financial reports. So,
Jane is on remote.
all right. Welcome, Jane, I think.
Yep, here I am. Thank you. I am able to put the information on the screen if you want me to, as we talk about it. I will share my screen if it works this time. Okay. So can you see that? And does it work for you on that end?
Yes, we can see it, and I think some of us have it on our computer also.
Okay. So the campus aging summary is the amount of money outstanding at the end of each month. And for historical, a year ago, that's what this was, and then it went up and down and up. And as Carmen talked about the technology backups, we can see that we have a delay here. When we had a technology issue in February, all of the claiming software went down. And we do maintain access for hand entering claims, just to give you an idea of what we do in a emergency where our software doesn't work. We can hand enter all the Medicare A and B claims and all the Medicaid claims manually. So we do have that backup to keep the cash flow going in case there is an outage in transferring electronic files. So. And with COVID, there weren't as many new admissions, so the blue line here in the last month is a little bit lower. And also we are doing a little bit different processing on our private pay invoices, so that money is turning around a little quicker as well, which brings the blue line down dramatically. So that's our interventions in the last couple of months. Any questions on the aging?
No, it looks like you can move on.
Okay. And the census graph compared to what our goals were. Of course, we were hoping to be more full in Central, and the Medicaid days have a little shortfall there. We're over our estimate on private pay, and under in our Medicare A. So as long as we keep getting Medicaid people, that is right now our best pay source. So that that all looks okay. Moving on, we'll get rid of that. The expenses. Do we have any questions on the expenses for the month of July?
The vouchers?
The vouchers.
Yeah,
Mhm.
okay. Supervisor Laufer.
Yeah, and on page 2 of the 3 pages, the biggest, of course, is one staff medical. Is that salaries, I assume? Is that what that is?
Yep.
Because that's almost half of the
That's agency staffing salaries.
agency staff. Okay.
Marvel and one staff, and it's separated out by CNA, LPN, and RN. And we can talk about that more on our financials and what the trends are. But yep, that is all the agency staff. And I did see RF Technologies here had a large amount, and that appears to be the, there were some touchpad exit controllers installed in each of the buildings. So that's the security when people wander. And if I'm not sure how that happened in the middle of the year, it must have been an something that was needed to be replaced. So
Those are waiting on an insurance claim. Actually, that was from when we had the building was struck by lightning or the ground was around it. I'm not 100% sure on that as it was while I was gone, but I got a brief report when I got back that we had an issue with lightning and it messed up our security system. So that is being processed through insurance, but we did need to purchase things immediately because that is a safety risk of residents wandering out of the building. So those are part of the security system, but I do know Scott is working with our insurance company for that.
Supervisor Story.
What is, just below that, under O and M of plants, there's the Bjork LLC Lewis. What is that?
I
Louis.
don't,
It's
I
four
don't
hundred
know.
and $5 under building repair and maintenance.
I can look it up if you.
I think that's the clean out of the grease trap.
Oh, so we have to regularly clean our grease trap from our kitchen. So they come periodically to do that. We have it clean, the smaller ones cleaned, are typically done by our staff, but we do hire in to clean the big one from the main kitchen, to make sure we don't have a backup of the grease trap.
And that's not the Bjork that's affiliated with our county board.
That's his son,
Ah, okay,
Larry Bjork's son.
thank you.
I have a question on leading choice. Is that an annual payment? I see one is for 7,900 and the other one's for 3,900. 2 different times.
Yes. Carmen, you want to talk about that or?
Well, I know what the leading choice is, but I just wondering, is it an annual payment?
Yes.
Yes, it is an annual payment.
Thank you. And why is it split in 2, not 3? Maybe I just missed the third one.
Yeah,
I'm not sure on that.
where are you seeing it?
Well, it's on the first page for one of the membership dues, 7941. And then under membership dues, somewhere down below.
What we do with the leading choice, we pay it and then we put it into an accrued expense account and then divvy it up over the months. So there could have been there's a payment and then we like unpaid it and then just applied this month's accrual. And it was actually for June and July. So there was a 2-month payment posted in the net. So within all those numbers getting posted and credited, that is probably the difference there.
So how much do we pay a year for leading choice?
That is a network affiliation charge per year. I can bring that up.
It changes every year because it's based on resident days. So Jane, if you could look up what it was this year. It changes based on your number of residents and resident beds, because it is related to getting insurance contracts. So they're basically a subcontracting group, that gets us rates for our insurance contracts. And so they base it on number of residents. So there's a algorithm that gets made up every year, but I don't know what this past year was.
Well, I guess it's not that important if this is an annual. I was just curious why there were two different payments instead of three, for example, like we usually have. And I was wondering if it was an annual one. You could get that to me later if you wanted, or get that to the committee. There's no need to do that right now.
Okay. And I am combining East, West, and Central here. So we don't have triple like dairy. So we don't have three different buildings of food and chemicals. It's really just repeating itself. So these are a consolidation of East, West, and Central.
Okay, that helps too.
I think that makes it more concise reporting. Any other questions?
Yes, Supervisor Story.
With that in mind, we wouldn't be able to look at this and know that it's only 3 of the 4 buildings, though. Is there a way to note, if we had to compare, go back and look at them, whether or not we're looking at numbers for 4 buildings versus 3?
You mean
Or
2
So-
versus 3?
2, no,
So we have 3 buildings and 9 households. So
That's
8 of
okay.
the 9 households are currently open.
okay, so I guess I'm wondering if we were full
Mhm.
and we looked at this report later, would we be, in other words, I'm wondering how we would know whether or not this is for a full, every household being calculated versus just 8 or whatever. Do you kind of understand what I'm?
Yeah, I mean, we have only had 8 open since 2021. 2021 was the last time we had the 9th open. So every report that we get currently is with 8 households open.
I'm just wondering if maybe that should be noted in case it were to change in the future and we did look back and we would wonder why it had changed so much. All of a sudden it's really high versus what it was before. We wouldn't know that there was a reason for that.
I can put campus on the top line here.
I think
So
that
it
would be
shows
helpful.
the whole campus. The prior reports from, let's say, a year ago, it would have another column here that says East, West, and Central. So
And I do understand why you're consolidating and it makes sense, but I guess just so we would,
it's clear that it's all 3.
exactly.
Okay. We'll do that. Anything else?
No, it doesn't look like it.
Okay. The amount for leading choice was $11,912 for the year. Oh, so, okay, we'll get rid of the expenses and we'll go to the page 1 of the financials. Go back up. I had it really big. Okay. We can start at the top, the revenue, the intergovernmental, that was the supplemental payment that we used to get here. And the projection is like, well, 496, 432 is our actual. That was a Medicare reconciliation from the cost reports. They kind of divvy up some mismatched numbers and they usually pay us a little bit every year to make up for immunizations. So that's just a very minor amount there. And like Carmen said, we're working on the supplemental payment being dispersed to all 3 buildings. Public charges, that would be our room and board, Medicare B, Medicare A, all those charges that we send out for. And we budgeted 15 million. In 23, we had 14 million, and during COVID in 22, it was 12 million. The rates, of course, are going up. So our projection for this year is 16 million 5. And I think we're on target to hit that. So our revenue would be a little higher as well as our expenses as they go up. So any questions on the revenues? Okay, miscellaneous includes the 240,000 projected includes senior meals, and it also includes some of the revenue from the bus. So it's a little skewed up and down. There's some bus revenue and just miscellaneous in there. So that's still good. Interest, we get interest on late payments. We get interest on insurance claims that if they go over their 30-day limit, sometimes they pay us a little bit of interest on that claiming. Donations revenue, that is from the bus donations that we applied to the bus. The 4,592 is the sale of assets. That would be the sale of the garage doors and of the old bus. What Scott does is puts that on the state website at auction, and people buy off of that, and they apply the revenue. We apply the revenue to each department when we sell things through the state auction. So the budget for this donation CIP is actually split with the revenue donations. So those net out. So that's okay to have a zero here. And the other revenue for CIP, that was the transfer for the bus money. We had some grant money from ADRC. Their transportation dollars helped to pay for the bus. They had extra dollars there and it all qualified under their grant. So we were able to supplement the cost of the bus for that. General expenses for salary and fringe is 7 million expected. And then the agency staff expected is 5 million, where in 23 we had 5.6, and it seems to be trending down. I'd like to go over that on the next page, the total salary and fringe costs, but they're right on target. Operating costs, we're estimating 3.3 million. Our budget was 3.7 million, so that's a good thing. We're controlling our costs, and depreciation is a little higher than expected because that bus is now in there and depreciating. That'll help on our cost reports. It's not a cash item, but it does help on the forms that we fill out to get our rates. And the CIP expense, that is the bus and the garage doors, and we're expecting to do the hallway trim in a building or 2 buildings this year for $10,000 each. So in the end, we have revenue expected at 16.9, expenses projected at 16.5 for a net good number of $456,000. Any questions? And that's with depreciation. Without depreciation, we're aiming to be $1 million on the good side, which will compensate for the prior years where we were a little bit negative. So I think in the end, when you look at it bigger picture, we're doing well.
Any questions on this part? We've gone through 7 months, so every month we get closer to the end of the year and that number is still positive, is going to be more and more accurate, I would guess. So that's
That is
exciting.
absolutely right, that the more months that you have in there, the closer the number becomes. And I don't see any other expenses that we're not allowing for. So I think it's a pretty accurate number. Okay, on to the staffing list here. I see the trend of this is the agency staff numbers. So if we go to the bottom number for agency staff grand total, we've got January, February, March, April, May, and so on. It started out in January at 503, and it continues down in the 400s, 300s. And so that's a good trend. Sometimes our invoices, straddle the months, so we want to look at more than just a single month, but the trend is that the agency staff cost is truly going down. On the other hand, the expense for our nursing staff, our hired nursing staff, is going up. And that is also what we were hoping for, that it started out at, 300,000, 400, and now we're going up to, there are 3 payrolls in July. So no, there would be 3 payrolls in August, excuse me. So that number will be different next month. But it's trending higher. So that means, as Chris and Carmen say, that, we're getting more staff hired on using less agency staff. And so that's how it pans out in the numbers, that proving that that is correct. So that's success. Questions on anything there?
Doesn't look like it.
Okay. This is the senior meals report. We're putting more salaries towards senior meals, so it's a little more accurate. So that retro amount is seen in here. So in the end, we are pretty much close to break even as far as the expenses and the revenue. And that's what we want to see, that we're accurately portraying our expenses to the senior meals. And the depreciation report is there. And that is the end of my report.
Supervisor Story mentioned that it's a good report. Thank you. I can agree with that. Any general questions, anything for Jane while she's here? Thank you very much, Jane. Then I think we need to take care of accepting the vouchers and financial report. If someone would like to make a motion to accept the financials and voucher report, I would appreciate it.
So moved.
I would like to make,
Supervisor
I'd like to
Lyon
second.
and Supervisor Wolf. First and second in that order. Any other comments, discussion? All in favor? Say aye.
Aye.
Aye. It is approved.
Thank
Next
you.
meeting time, date, and announcements. Do you have any announcements, Carmen?
I don't have any announcements, but I do want to look at the next meeting date, because it is currently scheduled to be on a day that both Jane and I will be at a conference. So I'm looking at potentially rescheduling that, so we don't have to have everybody on Zoom and stuff. We could make it work, via computer, but if we could reschedule that, that might be easier if that works for everybody.
How would it work to schedule one meeting for September and October? Would that affect the budget thing?
I can check with Beata to see how the budget
Okay.
is.
I'm asking Chris Corpola right now how it affected, and she's responding.
Yeah, so you have not, as a committee, haven't had a chance to see the 2025, which you should see in August, but if you see it in September, it's okay. So all I would say is probably earlier in the month is better than later in the month.
Okay.
I don't anticipate that there's any issues with it because it looks very positive, but just to throw that in the hat.
Because our scheduled meeting is September 26th, but that would not work great for Jane or I. So I can pull up the public meeting calendar too to see what else is earlier, but if there is a date that works for everyone on this committee.
If I may.
Yes, go ahead, Supervisor Wolf.
Thank you. I am scheduled to have a knee replacement surgery on the 19th of September. So quite possibly the week after the 19th would be a little bit of a fog for me.
You said the week after your surgery.
Right. Well,
So we could do it before.
I'm expecting a little bit of pain and a whole bunch of rehab along with the knee surgery.
Yeah.
Would be so. If we can, we're looking at the 26th right now. If we could move forward prior to the 19th would work best for me.
Thursday,
Thank you.
Thursday, the 12th does not have um, any public meetings on it, if we wanted to move 2 weeks ahead.
So another potential option would be to do a remote budget review at the early part of September. You could just do it as a virtual meeting. And then, like, Supervisor Kinnear suggested, maybe do a meeting first week in October. That would be your September and October. You do that as well.
Chris Corpola suggested that we could have a remote meeting to approve the budget, and then meet later again in
The beginning of October.
October. I guess. I'm getting my months mixed up.
So the first 2 weeks of the public meeting calendar, there's very little besides the first two Wednesday, or the Wednesday, the 4th and Wednesday, the 11th have several meetings.
Are you on October?
No.
I'm on September
You're on
for
September.
for the budget part. If we wanted to do September to approve the budget of just a virtual meeting.
Yeah.
And then early October,
The third.
So let's look at the a budget meeting, a virtual budget meeting first. We can do that anytime.
Yep.
And we could do that tomorrow if we wanted to, but no, tomorrow later. But would it be best if we took care of that sooner rather than later?
so the first week of September, maybe?
Let's do that the first week of September if we can. You will be gone.
What about next week? And next, I mean, I don't know, Jane, it's completed.
It is completed. I would like to have a little more time to look at the trends and refine the budget. It's all in a positive bottom line, but I would like a little time to refine what the goals are as far as expenses for dietary.
Sure.
Yep, just to make sure it's a tight budget. So a week, give me a week and I can get that updated.
How about September 9th? It's a Monday. What, we're looking for Gordy to be before the 19th,
No, of next week.
August. Oh, August. Oh, we could we meet right before then?
Like
Is it, like come early?
Yeah. 5 o'clock or something?
Well, how long?
Yeah.
Jane, how long would, we've seen, yeah,
Just a couple days I need.
but to present it, I
To
mean,
present it, do you think like a half hour probably?
Oh, yeah, yep.
So we could do maybe do 4:30, so it gives us a buffer.
yeah. Well, that's a good idea. Who suggested that?
And there's nothing on the public meeting calendar before it, so
That's 4:30, August 28th.
it'd be here.
Mm-hmm.
August 28th. That's right before is there a budget workshop that day?
Yep,
Yes, there is. That should only be about a half hour, right, Chris?
budget workshop.
They will.
Yeah,
Just say yes.
That's at 5 o'clock, right?
5:30.
yeah.
Okay, and then we want to look to October to have a regular meeting as the next regular meeting.
Mhm.
Well, we could have it in October or normal time.
Yeah.
Let's just do the normal time in
Okay.
October.
Sounds good. So pretty much just skipping a September meeting.
Yeah.
then. Okay.
Yeah.
So your August meeting is in person then, since it's right before your budget meeting?
Correct?
Okay.
That would be our September meeting.
And then.
But just over budget. We're not going to do the rest of the report.
Okay, so we have it set for August 28th at 4:30 before our budget workshop.
Yep.
And then there will be no neighbors meeting in September, but we will meet our normal time in October.
Yep.
Which is the
Fourth
fourth
Thursday.
Thursday at 9 a.m. Okay, great. Any announcements, Jane or Chris or anybody here or?
Anybody need cucumbers?
With that, I would say we are adjourned. Thank you for agreeing to. We have plus.
Oh,
going good.
This is just a small.